in the PDF, we have around 30 odd scientists, so it becomes little bit hodgepodge for everyone to remember. So in the initial go, I've kept 5 scientists and all their associated questions that can come from the same topic and other previously asked questions. So let's start with today's session. Guys, for the people who have joined recently and are not aware of this image, this we have like I think third or fourth times we are discussing it. See, this is how you will be going. Your exam viva will be going around. This is the important thing that is around the 100 marks which will be there for your OSCEs. Okay, so we'll see how to go about your OSCEs in the next page. And apart from that, we'll be having clinical discussion. That depends upon the center which you have got, whether they want to give you 2 short cases or 1 long case only. Depends, and it is different from center to center. And same over here in the ward round and the table viva also, it is dependent upon what kind of patients are available in your hospital. So one thing that is over here, that is the case discussion. Case discussion, these 100 marks are in your hand, and whether you get more than 60-70 marks or you get less than 50 marks, it's absolutely the work which you put in, which you have put in over the last 3 years and the remaining 1.5 months. Okay, OSCEs are not under your control, but these 100 marks are definitely under your control, because you know by sitting in your house that which case will be given to you. Okay, so guys, it is still 1.5 months left. Focus on COMS commerce. If you have not presented in your hospitals, if you have not attended the discussions in your hospital, this is very important. And you are unable to join, Dr. undergone the discussions of COMS commerce, please pull up your socks. These 6 weeks, this will be, I'll say, a make or break for the 100 marks that will be given to you. If you score more than 60-65 marks, so आपको 50% से ऊपर whatever 15 marks that you have got, they will act as a cushion for the OSCEs which come. Why? Let's see. Because see, there will be 20 OSCEs. Out of these 20s, there will be 0.5 that will be complete bouncer, complete blinder. There might be scenario that you might not even recall like what is this topic, whether this question is from otology or laryngology. This can also happen. I'll give you my example what happened with me. Initial 10 OSCEs which I gave, all 10 I knew the answers. This was way back when I gave my exam. So I was like, chalo, I'm getting very good marks. And from question number 11th, the surprise started, that it was like I was able to identify but only 1 question or 2 question. And by the time I reached 15th question, 15 to 20, they were a complete blackout. I was like literally unaware ki, bhai, from which topic are these OSCEs being asked. So this can be scenario for the OSCEs for everyone. So what I generally, every time I tell all batches that guys, please be realistic. You all are not superhumans ki 20 out of 20 you'll score. 10 to 15 OSCEs jo hai, this is your what you will get, because what I say this will help you score around 50 to 60 marks over here, which is easy go to achieve your 150 marks. Out of 300 marks of practical, you just need 150 to pass. Okay, so I'm not talking about toppers, I'm talking like for people who are like just mediocres. Okay, so you just need 150 marks. This is 50, and from your the long case, the case which you go around 60 or 70 marks which you get over there, this will easily see you approx 130, and remaining 20-30 marks, whatever is remaining, easily up. If you perform even in a mediocre way in your table viva and ward round, just give the basic answers, definitely you are going to get more than 150 marks, and we'll clear this practical together. Okay, so topics, how to break off this OSCEs topic, because this always remains a problematic thing. While I was resident, I asked my mentors like how to go about OSCEs. The only answer which I got is just break it in topic wise from Scott Brown and do it, but nothing apart from that. So one traditional way is you just divide it as the otology, rhinology, head and neck, skull base, and recent advances. This is one way. Okay, then. And secondly, apart from this, just break it that how are they going to ask you the OSCEs. The pattern which I have observed over the last 5 years, They'll give you some instrument, 1 or 2 instrument from here. They'll give you short forms. This I see very easy. 2 marks definitely you can get from here, from your OSCEs. Then your pharmacology, definitely one drug which will come for your exam. 1, 2, 3, 4. Osteology, the main bones that you have to see. One is your mandible, one is your maxilla, base of skull, and of course temporal bone. I don't count it because as everyone goes with the thing that temporal bone is bread and butter. So I see that you are through with this board. 1, 2, 3, and then there will be one section from radiology. Normally it is NCCT PNS only, oblique HRCT temporal bone. Else it can be a MR section of from something related to your parapharyngeal spaces can also be given to you. Apart from that, HPE, biostat and audiology. Then procedure based thing, or they'll give you a short surgical clip, a surgical video based question, because of late there are video based questions, there are GIF based questions. So this is a potential topic from which they will give questions. And last is some syndromes. They put 1 or 2 syndrome which I am seeing last 2 years. One Treasure Collins is being repeated, which we saw over the previous week. That child's image with Waardenburg syndrome is being repeated repeatedly, and they have also introduced something called as calculation based question. Now, what kind of permutation and combination they will keep for you guys, that is, I'll say, up to your kismat. It's about your luck, how it will go. But what I suppose is there are around 10 to 15 questions that are easy for you. You just don't mess up with that. Mess up with those 10-15 questions. Just apply the basic knowledge, whatever you have seen. You will easily get more than 50% marks for that. And remaining 5%, 5 questions, this is your hard work, this is your kismat, this is your, I'll say, what the blessings which Lord has kept on you. This is about that. But as a resident, don't get disheartened, because in OSCEs it is not a single pattern. The same questions will come in across for every station. No. People sitting in Delhi might get a different set of OSCE, and people going giving exam from Mumbai will get a different set of OSCE. If you are unlucky person, there might be that these 5 difficult questions come at once. Okay, so don't get bogged down by the fact here 5 के 5 गलत हो गए. Let it be. Remaining 15 पे focus करना है, because if you lose confidence, if you lose hope, तो ये remaining 15 में you will make silly mistakes, and that will cost you your exam, and it will cost you 6 months. Okay. So with this, let's start with this our session. So Dr. Sahab, this is how we go about. I'll request people, please unmute yourself. We are just 4 to 5 weeks away from our exam. So just take it like you might get the same question in your exam also. Okay. So let's see. I totally understand the answer might be wrong. Definitely, it will be the case. But we have to practice and not make the same mistake in the exam if this question is repeated or relative of this question comes in the exam. Okay, so identify the person and what is his contribution in ENT. So Doctor, anyone? Anyone wanna try? Let me answer. The name of this gentleman is C. Kumar N. Patel. Okay. Now, what is his contribution in ENT? CO2 laser. CO2 laser. Okay. So whenever you see this image, or whenever you see hear about CO2 laser, all the 5 points which are important regarding the CO2 laser should come into your mind. First, what is its wavelength? What is its use? And anything extra about it. So what is its wavelength? This is 10,600 nanometer. Don't forget the unit. This is one mistake which we can get. Okay. So see what I say now in DNB, small things make huge impact. I was just discussing a person who couldn't clear his theory exam day before yesterday. In your theory exam, you got a question ki write a draw a diagram, label diagram of intrinsic membrane of larynx. है ना? And that guy had obviously it was in the pressure of exam, people make this mistake. He had drawn diagram of intrinsic muscles of larynx, and DNB gave him 0 marks. Okay? And you understand the plight of the person who's failing by that paper by 2 marks, and in such an exam आपको 0 marks दे रहे हैं, which was I think 4 or 5 marks का that question was there. Okay, this is how what I say, this is your bad luck only, that we make such mistakes. So in this CO2 laser, please don't forget this nanometer. This is important. And what are its uses, we'll just see in a while. Uses of CO2 laser are humongous in our ENT setup. Like in the otology, we go for the stapes surgeries, we go for the myringotomy. In the rhinology section, we go for the turbinate reductions. Okay. In the laryngeology section, we go for the vocal cord lesions. In the initial malignancies also, laser is used. Okay. So now here only, let's see what all questions are related from the laser section. Okay. We will definitely revise this when we will be doing the recent advances. Definitely, people who are from the joint previously, they have already seen this image. Let's see what all you remember. Just see this image. See the image given below and answer. What is fluence threshold? What is laser safety? What are tool uses of lasers in ENT? Okay. So, Dr. What is fluence threshold? Let me answer this question. Fluence threshold is minimum energy per unit area which is required to initiate specific changes in the material. Like, what is this? This is minimum energy per unit area required to initiate specific change in the material. Okay, so whatever ablation you are doing with the tissue, that all things start with this. Okay, what is laser safety? We have all remembered this thing, like right from the board which is outside the OT, the people should be using laser safety goggles, the laser safety tracheostomy, laser safety endotracheal tube should be used. Okay, and all those things let's see in a while. And what are uses we definitely saw. These are the principles of safety that you should see. This is from Scott Brown, and there's something called as laser fluence also, which might be a question. Laser fluence. What is laser fluence? This is basically energy density at the illuminated area. What is laser fluence? This is energy density at illuminated area. ठीक है. See guys, we all have studied lasers for our theory exam. हम सबने पढ़ा हुआ है. But how to take out the practical points from that section, that is important, and that is how what you should remember for the exam. Okay. Let's see what all questions related to this laser have been asked till now, and I'll request your participation. A 26-year-old woman presented with bilateral progressive conductive hearing loss associated with tinnitus. She underwent a surgical procedure as shown in the image. There was history of similar loss in the mother also. Identify the procedure. We all can see what procedure is being they are doing over here. What is the answer of first one? What is the procedure? Absolutely correct. And believe me, you will definitely get one question from otosclerosis / stapes surgery. So believe me, if you prepare accordingly, आपको सिर्फ 19 questions के लिए prepare करना है. You will definitely get one question from this. Okay. So wherever you see the hearing loss is bilateral, wherever you hear something about pregnancy, examiner is trying to tell us that the answer is otosclerosis, something related to otosclerosis. Okay. So we saw when is this procedure indicated. Okay, now this is why this question was kept in this section, that what is the most atraumatic technique to perforate the stapes footplate? Answer becomes your laser. Okay. Now what is the most common site of pathology and the mode of inheritance? We have seen it, discussed it. The most common site of pathology is fistula ante fenestrum. Fistula ante Fenestrum. And it is autosomal dominant. And what does this DACS stands for?
Direct acoustic stimulation.
Direct acoustic cochlear stimulation. Okay, so this is what I was saying. Like this तरीके से आपको you will be getting 2 to 3 marks for the like short form. Like you have got one. So this similarly you will get something 2-3 marks for your exams. One very common question is the sequences of MRI. Flare, Fiesta, Grappa, CIS, all these things, please make a chart, make a soft copy PDF, star mark करके रखो, paste that chart in front of your table, revise it multiple number of times till your exam. You will start, if like you think that I'll start remembering it after 25, 26, believe me, it will get so much jumbled up, you will leave it. Okay, so work on this thing. The answer for DACS is direct acoustic cochlear stimulation. It's important. Let's move to the next question. Again from otosclerosis, this is the answer of this. Let's see, stepwise. What is the A, B, and C? So A is perforator. B is burr. The name is Larkin's hand burr. See, I have repeatedly kept this question. I think fourth or fifth time it is being pushed over the last 1 month. Okay, so there is a specific purpose. Please don't make this wrong. This is very important to you guys. Okay, Skeeter. ठीक है, Skeeter को they have given it as a combined image. Skeeter has come as an independent question. So you can realize the importance of an instrument if it has been repeated twice to thrice in a pattern of in a period of 3 years. Okay, so this is name the surgical procedure we just saw. Mention the no contact tool. We know the answer is laser. That's why it is kept over here. Now they're asking you 4 intraoperative complications of this procedure. Fourth, so we all remember it is facial nerve injury, it is injury to chorda tympani, perforation of the flap, then injury to the ossicles, floating foot plate, okay, CSF gusher, all those things you can write over here. And this is how, let's complete it. 1, 2, 3, 4. Okay, one more thing for the OSCEs. Guys, you just see, they have given 1.5 marks for like enumerating this. 1 marks to tell you ki what if this 1.5 here, 1 marks here. So what I meant to say, there is division of marks for the question. Like if you give your entire 4 minutes to this question only and you don't answer anything here, you will get 0 from here. Whether you get 1.5 full or not, that depends upon it. So that's why attempt all questions. Attempt all questions. You should not leave anything behind. There is no negative marks. Okay, there is no negative marks. So let me explain you. It's like a free hit type of thing. है ना? बल्ला चलाना है. You have to write it. If you just leave it, obviously you will not get a run out of it. है ना? छोड़ना नहीं है. You should not leave any question. Okay, this is the tube, which is the laser safety tube. Image is from Scott Brown. This is Murphy's eye. This is Murphy's eye. This is for ventilation of the patient in case the tube gets blocked. You just see these two cups which are present in this tube. There are 3 things which can be asked from this section. So all included here. Now, similarly, one more question. What they can give you, how this question can be presented to you. They'll say this is A, this is B, this is C. Now they'll say कि what is A, what is B, what is C, or what is D. Sorry, this is cytotoxic भी है यहाँ पे. ठीक है. Or they can ask it the other way. कि what is the symbol for laser out of ABCD? Give it for half marks. Okay, this is how also they can ask it as an image-based question. So this question can come from like this section. Similarly, a image-based or logo-based question is seen in the health programs. National Program for Prevention and Control of Deafness. Okay, this is the full form and the image. It has been asked to you. Okay. Similarly, they'll give you another images related to the health programs. What is the WHO? When is the hearing day celebrated? What is the theme of hearing day for this year? These type of questions can come in your exam. Now, coming to the first scientist for the day, identify the person, give her contribution in ENT, image is not exactly that of Scott Brown. Scott Brown में madam का image is there where the hairs are more golden. Okay, here the hairs are less golden. So anyone with the answer? Okay, madam is Dr. Valerie J. Lunt, and why is she remembered? You should remember the LM scoring, which she was associated with LM scoring. Okay, so this is the LM score. Okay, they might ask you questions from this LM score. What is this LM score? What is the maximum score that you can get from an LM score? 1. And apart from that, extra questions from this section. Let's have something for you to do tomorrow. 1. Please read Bent and Kuhn classification. Must know for you. They will give you it. Write what is the criteria used for AFRS for 2 marks. Okay. Second is AFRS. These both of them are must-know type of question, and believe me, these are must-know. Don't realize it after you give your exam. That will be sad for you also and for myself also. So that's why I keep on repeating. Please remember this AFRS, the stains which we use, the named signs which you use. Please remember it. Okay, they have been discussed previously. We will discuss it again. But the purpose of putting it as a red question over here is so that it should tick your mind, tick karke ki you have to read it again. If you get stuck over it, you don't find the answers, please drop me a message. Okay. Third will be over here only aspergillosis. और here पे galactomannan test. These 3 things you have to remember from this section. Remember the image of Dr. Valerie J. Lunt. Now again, this is an easy one. Someone?
William House.
Yes, doctor. Again, this image is from Scotland, and he is the, I'll say, father of neurotology, and the most important image which could come out of your otology section. So, sir is Dr. William J. House. He is father of neuro-otology. And what all he did, whatever we say, it is less. Cochlear implant. He implanted the first single channel cochlear implant. Then he started ABI along with neurosurgery guys. Then he developed something called as House Urban Retractor. This is used in the middle cranial fossa surgeries. Then he identified Bill's bar. This is the vertical bar which you will be seeing in multiple places. Okay, so let's see this thing.
सर इनकी इन्वेंट्री पे भी कोई क्वेश्चन है क्या? मुझसे एक बार फैक्ट में वाइवा में पूछा था कि इनकी इन्वेंट्री के बारे में बताओ.
कॉक्लियर इम्प्लांट एंड एबीआई
इन्वेंट्री मुझसे सिर्फ इतना पूछा था कि डॉक्टर विलियम्स ने उनका इन्वेंट्री कहाँ है और वो क्या है, किस चीज के लिए है, ऐसा कुछ फेमस.
तो 2 चीजें ना. हाउस सर का तो पूरा हाउस इंस्टीट्यूट है ना, हाउस इंस्टीट्यूट है where people go for training of neurology. So if the exam
to ask for the house institute only.
Exactly. See, this is like this question you can take it in 2 ways. Inventory, one thing is like what all he invented, and second what you said, है ना. तो दोनों में से कुछ भी हो सकता है. तो one is the institute which he has, which is there in his name, where all the people big shots go for the training in the neurotology. And second, अगर inventory क्या invent किया है, तो I suppose it should be cochlear implant and ABI only.
Okay, sir.
Okay, जी. So this is the House Urban Retractor. Remember the image. Okay. Retractors form one section of your instruments. Okay, so please add this House Urban Retractor in your retractors list. Okay. Now this is the Bill's bar, not related with this, just ki Bill's bar डालना था तो I placed it over here. It's an important question. Now this is an important question. Why? Just see this image. We just saw it. Now I'll not bore you up. I don't know how. This is the section of temporal bone. Okay, and here the red star, which I hope you can see this red star. Okay. This is the Bill's bar. Okay, so they can give this kind of section also and ask you that identify A, B, C, D. What is this red star? What is this blue dot? So answer I have included in this section only. The name of journal is also there. Okay, so this is the important section. Can come as a part of a question for 1 marks or 2 marks. Okay, so let's go ahead. Identify this gentleman. Smart German chap. Name of sir is Dr. Heinz Stamberger. Dr. Heinz Stamberger. Okay. Remember his name. He is important and he is father of functional endoscopic sinus surgery. Father of functional endoscopic sinus surgery. And second thing what he did was he popularized Messer-Klinger's technique oblique Messer-Klinger's principle. Why? Messer-Klinger was his teacher. Okay. Now, why I am telling you this thing is if your examiners are old timers, old people, they are very fond of asking this kind of historical question. Gluck Sorensen ne Gluck kaun tha, Sorensen kaun tha? These type of questions. Who was teacher, who was pupil? So remember from that section. Similarly, over here, Sir Walter Messer-Klinger was the professor, and this Stamberger sir was his student. Was favorite student type होता है ना HOD का there is one favorite resident उस तरीके से. So after Messer-Klinger, he was the one who popularized his technique of preserving of the mucosa and all those technique. Okay, so remember this. Remember his image. Now this one. Identify anyone. Who is he? Sir is Walter Messer-Klinger. अभी just नाम सुना, अभी image देखो. ठीक है? He is important. Multiple questions can come from here. Image एक आपको याद रखना है. He might ask you what is Messer-Klinger's principle, what is Messer-Klinger's technique, and the question which I saw on OSCE is what were the 5 lamellae of Messer-Klinger principle. So the first lamella, rather I'll say what is this? These are the structures which you encountered during when you go from anterior to posterior during the surgical approach. So the first lamella is the uncinate process. Okay. Second lamella is the basal lamella. Sorry, my mistake. Second lamella is the ethmoid bulla. Second is the ethmoid bulla. Third is your basal lamella, also called as the ground lamella. Fourth is the superior turbinate. And fifth is the supreme turbinate. Okay, so this can be a part of the question that what are the lamellae of Messer-Klinger. Okay, now so remember 5 scientists. I didn't want to put 15 scientists in a day and you all forget about everything. So fix these 5 things. That is important. One, and just try memorizing them. Make a small section in your WhatsApp chat that these are the syndromes that I'll revise daily. These are the images which I'll revise daily. Okay. Now again, this is a very important section. This will not leave you behind because it can be asked from the biostat section. It can be asked from the oral cavity section and from the recent advanced section as well. Let's see what they're asking. They are asking. This figure represents estimated overall survival and the corresponding hazard ratio in the elective surgery group and the therapeutic surgery group in the N0 neck in the oral cancer. Guys, you would have read in the theory management of N0 neck. It is the section from question from that section only. Name the graphical representation. What is the answer, doctor? बताओ. Kaplan-Meier graph. Okay, this is a very important question. You should remember it. It is like I'll say there are few must-know type of question. So this is from that. This is of that importance. आपने theory में you would have read this question कि what is the management of N0 neck in C oral cavity. So this is coming from that scenario only. What I'll recommend is please read this paper, De Cruz et al. ठीक है, by Dr. De Cruz et al. Management of N0 neck in CA oral cavity. एक बार आप पढ़ना, ठीक है. Next class we'll start with this paper only. Discussion of this paper. 5 minutes we'll just see what all important things are there. Where you can find it, either you can see on net. Otherwise, just see CA oral cavity from Scott Don only. वहाँ पे they have again described it in a short paragraph as well. So this graph is from that chapter only. CA oral cavity से दिया है from Scott Don. Let's see what they are telling you. Just see this red pointer. They have two things. This is the x-axis, this is the y-axis. Here they are giving you the probability of overall survival, and यहाँ पे there are two things. First, the above one is the elective surgery one, and the bottom one is the therapeutic surgery one. Okay, so what happened in this section was, let me help you with this. Guys, this was a wide experiment carried out by Dr. De Cruz et al. In the patient of CA oral cavity, when a patient reported with CA oral cavity, what he did, he made two groups. One was elective neck dissection. मतलब patient came with CA oral cavity, and whether irrespective of whether he had neck nodes or not, apart from wide local excision, there was elective neck dissection also done, and there was something called a therapeutic neck dissection group. मतलब people were kept, यहाँ पे the main surgery WLE was done, the tumor was removed, but there was nothing done to the neck, and the patient was kept under observation, like regular ultrasound of neck, oblique, however they were observing him, and as and when the neck turned positive, then the neck dissection was done. Okay, so then they compared the result of these two groups. They found that people who were undergoing the elective surgery, they had a very good, I'll say overall survival was better as compared to this group. Okay, so this is what they are depicting over here, that the people who are undergoing this elective surgery, they have better overall survival as compared to the people who are going the therapeutic surgery. Okay, so this is what you have to answer in this graph, that is interpret the graphical representation and describe your results in one line. तो one line में यही बोलना है कि the probability of overall survival in the people of elective surgery group is better than those in the therapeutic surgery group. This is what you have to answer over here. Okay. And coming to this section, that what is the advantage of representing data in the graphical form? This is like just feel that it is easy to compare the two groups. It's easy to determine the survival in another group. इस तरीके से you can answer this question. But this is the main thing that you should remember from this graph. And what is this hazard ratio? In hazard ratio, please remember that hazard ratio compares the risk of event occurring in two groups. Let me write it. Hazard ratio compares risk of event occurring in two group. Now यहाँ पे क्या event हो सकता है? यहाँ पे event that is death. So basically they are occurring, comparing what is the risk of death in this these two groups. So the question which can come is the hazard ratio. अगर hazard ratio आपका 1 है, इसका मतलब there is no difference. If hazard ratio is less than 1, it indicate lower risk in the treatment group, and if the hazard ratio is more than 1, it tells that the treatment group has higher risk of event. Treatment group has higher risk of death. Now in this question the hazard ratio is 0.64, है ना? 0.64. this का मतलब क्या हुआ? This is less than 1. So it indicates that the group has lower risk in the treatment group. The risk of death is less in the group. So what it was, HR was 0.64. इसका मतलब हो गया in the treatment group, the risk of death is 36%. 36% reduction in hazard ratio. Okay. So I know it's boring, it's confusing, but somehow please remember it. This is important. And apart from this Kaplan-Meier, second task is forest plot. Okay, let me introduce these questions slowly and steadily to you guys so that you just don't like dissolve ki what all is happening over here. Okay, read about Kaplan's Meier, read about forest plot. We'll discuss them again. And Kaplan's Meier, I'm sure ki we'll discuss at least 2-3 times till you like go for your exams. Now let's see this question also. This is a child who came with brachycephaly, that is a short head, and syndactyly. Syndactyly का मतलब होता है, this is the like what you see over here. That is, there is fusion of the digits of hand oblique foot. Okay. Now what is, yeah, Dr. Saab, absolutely correct. Discussed yesterday. This is Apert syndrome. Dr. Saab, what's the answer of gene involved? Make a list. FGFR2. ठीक है. Make a list, small list. We have around 10 to 15 syndromes. 10 जो है, they are very important. Remaining 5 तो just जबरदस्ती के उसमें we've just added to complete the list. Just make that in a tabular form. One gene involved, whether dominant or recessive, specific 2-3 points. There are something for every year. There is one more thing which occurs. There is fixation of stapes. Okay, so they might ask you what is the otological demonstration from this syndrome. Okay, so remember this. So just keep on increasing your list. Keep on increasing your list, and we will just complete this, I'll say, within 2 to 3 weeks, so that you have that last 10 days for your revision. And 2 suggestions from my side. First, start to make a PDF oblique a WhatsApp message where you write down what topic you feel confused. I repeat this thing multiple number of times so that someday or for someone it clicks. Okay, for every person this will be different. I'll repeat it, for every person the difficult topic list is different. Okay, so don't just get carried away by the list of your topic by your co-PG कि उसको ये नहीं आता है या मुझे आता है. It is immaterial. You people will get different centers in different parts of the country. Okay, so make this list. I suppose there will be around 20 to 30 topics which you will be like, this is like confusing to me. I need to revise it in the last moment. Why I am saying this? Your exam will be on 2nd of April, but believe me, before like 2 days prior, you will be in that moment of traveling from your city. Like example, you have done your PG from Chandigarh and you get your center in Kolkata. This will happen. Okay, so you will be like busy in your flights, tickets, and all those things. So उस समय पे you like mind completely refuses to study. पढ़ने का बिल्कुल मन नहीं करता है. So that is the time when you will have something to revise. You will have something to keep you motivated. You will have something which will allow not to make yourself underconfident and depressed. Because this is what happens. You work hard for the entire 5 weeks, 6 weeks, but as soon as you hit the last week, वहां पे जाके the confidence just shakes. Confidence like भाई मेरे को कुछ नहीं आता है. This happens with everyone. Okay, I'm not saying ki because it happened with myself. It happened with my juniors from the college, and after that 5 years I'm seeing down the line. It happens with everyone, but believe me, most of you, 90% of you, swim across. Just keep faith in yourself. Last moment tak, just keep reading little bit. My suggestion is until the last week, please give at least 2 hours. That is more than sufficient. I know you all are working somewhere or the other. Okay, it's very difficult to find out time, but try pushing 2 hours until the last 10 days. आखिरी के 10 दिन, put some chutti, annual leave, whatever leave you are getting, put it so that you can increase your momentum of studies. And third thing is, as soon as you get your centers, there will be some time before you get your centers. As soon as you get your center, believe me, book your flight ticket, oblique train ticket, however you are going, and your hotels. Okay, I know as a teacher I shouldn't fiddle with all these things, but believe me, it's important. Reach your center 1 day prior. Like suppose अगले दिन आपको 8 बजे एग्जाम के लिए जाना है, like that night, that dinner, you should be in that place only. It should not be that you are traveling that entire night. Your adrenaline will be high. It is just nonsense. Okay, and this hotel, है try taking a room, whether it's bad, whatever is thing, nearest to whatever center you get. I'll give my example. My center was in Nanavati Max Hospital, Juhu. Okay, and I was staying in Kolaba because one of my batchmate was in Kolaba. So just to stay with him, meet him, I went to Kolaba, and the result what happened? To reach this Nanavati Max early in the morning, I had to start because of the traffic and all 2 hours prior. Okay, bina breakfast and you're just traveling like an idiot. Okay, but when I saw people were like in Nanavati Max ke 200 meters where people were staying in a room. Okay, so these are the things which you realize after making some mistake. That's my job, like over here, like till the last 1 month when we are together. That this is the mistake which I have seen people making, and you try not to make it. Ultimately, it's everyone's own exam. Okay, so this is a small class for today. 24th class is very important. COMS Commerce. I'll let me repeat it again. It's very, 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 very important. Okay, so if you have not taken a case till now, not felt that so please attend it. One, revise your notes entirely, and just attend it like supposedly you are giving your exam. Okay, just don't attend it for the sake yaar theek hai, for the please attend it sincerely, and I'll share you 2 videos of 1 hour duration each, one from the Janki sir's word round and one is more. Okay, so they also contain the questions. Second, I'll again share the list of questions of around 100 Viva questions, around 20 pages mein hai aapka. Please ratify it. Okay, these are the basic questions. If you manage to cross this thing till the examiner asks you, Doctor, how do you manage the case? Believe me, you are getting more than 50% marks in your exam and you'll pass the exam. Okay, so we'll meet on 24th. Next 3 days we'll focus on this otology section only, and let's see. And if you get stuck somewhere, any problem like for you guys, please let me know. We'll just try simplifying things in a better thing. हाँ बताओ.
सर
हाँ.
सर ये सर स्कॉट कैसे कवर करनी है, लाइक थ्योरी या फिर रेट्रोग्रेड जितना प्रैक्टिकल में कुछ है?
See, if you have not covered it till now, तो I will not say अब नहीं खोलना.
नहीं सर, पढ़ लिया है, बट उसको थ्योरी जैसे ही पढ़ना है.
Exactly. Whenever you see the question which you have asked till now, ना, I can name 3-4 people who have just called in the last week कि इस तरीके से problem आ रहा है. See, you have read theory, like example, laser आपने theory से पढ़ा, ठीक है, but today we saw 3 images from laser which can be asked. So whatever like theory you are revising, ultimately everything is theory only. So your mind should tell you कि यहाँ से ये point they can ask you. Okay, it's not that कि क्या बोलते हैं कि laser you have already you know how to write 5 pages on laser if it comes as a long answer question. But what 5 points you should know for the like to write in the practicals, that is important. One, like second question again I'll tell you from today's class only. Like you have read otosclerosis multiple number of times, but if you falter in telling what are the complications of stapes surgery, so useless हो गई वो चीज, है ना? Getting my point? So you have to revise from same thing, but in the your mind should tell कि this is the image, this can be asked as a OSCE also, and how to answer that. So all the images of Scott Brown and Lalwani I'll cover in the next 6 weeks. Previously also I was doing the same, and I got a very good response from everyone. So that's why I've not fiddled it with that. Along with the previous year question, Scott Brown, all the images will be covered in all the sections. When we'll see otology मतलब all the images of otology will be there. Howsoever not stupid question it sounds, but I generally put it कि एक बार देख लो at least कि हाँ ये image यहाँ से this question can come. Okay, so revise. If you have read Scott Brown, definitely it's the best thing. उससे अच्छा कुछ है नहीं अपने as a resident, nothing better from that. But just see the image along with it. One, just see what question can be asked from that. Two, that's all what I have to say.
Okay.
And so for the Viva, the 4 stations of Viva, like for that we have to read the theory only.
Table Viva.
Yes sir.
No?
Yes sir.
That is absolute theory. ठीक है, that is absolute theory. But like what I'll say is कि see जो table viva आपका है ना,
yes sir,
ठीक है, table viva is like what they happened to do last year. They had one section of osteology, Okay. They had one section of even the HPE specimen people were kept, and there was one section of the radio scan, and one was miscellaneous. They had instruments, they had multiple other things. Okay, so this is what I'll say is dependent upon center to center. Like
in some centers, there were theory questions were also asked, like from osteology, rhinology, that recent advances, like 15 questions were asked.
Yes, doctor. So that's what I'm saying. It's all about theory only. It's nothing new will be coming, but you should be trying to incorporate those things into your practical exam. Like in the recent advances, आपको जैसे example just telling कि like coblation हो गया है ना, we all have read about coblation, so they'll just drift you कि yes, what is principle of coblation, okay, temperature कितना जा रहा है, like suppose cautery आ गया कि cautery में what is the temperature which can be there in the bipolar cautery, what is the RPM of the drill which is being used. Okay, so there is no specific thing which an examiner asks. Okay, in the table viva he would have made a list of 20 questions and he'll ask the same plus minus 2-3 questions from the all the candidates which are coming. So just revise your theory, that will help you out. बाकी जो ये minimal points है like here and there, जो the changes which are there, this will easily cover over the next 4 weeks. You will still have around 1 week or 10 days for revision for yourself only. Nothing from extra what you have to do, you have to revise those things. But what I have seen is during the end, when we come to the, I'll say अभी Feb चल रहा है, middle March, as soon as we'll cross ना, there will be so much to revise which will cause problem. So whatever you are doing, just keep on tickling it. Like today, what I have done, like what I have thought to do is just a minute, where is this group? Yeah. So I have shared this image in the group. Okay, let's keep repeating it daily. And this should be the first thing you revise in the morning. Like we have seen 4 syndromes till now: Treacher Collins, Wardenberg, Pierre-Robin and Eberts. ठीक है, कल इसमें 5वां syndrome add हो जाएगा. So whenever you see the 5th syndrome in this list, revise the 4 syndromes that have you have seen it, along with the questions कि कौन सा autosomal dominant है, what is the specific gene involved in Treacher Collins, what was the specific thing in the Wardenberg, how are you gonna identify this. Okay, so and similarly second thing कि sinus tympani facial recess हमने discuss किया है, कल इसमें Prozac space का boundary add करके या frontal recess, whatever extra we are doing, we'll add it. So keep revising these things daily. Daily मतलब सुबह आप उठ रहे हैं, so while you use your normally this is what everyone does it कि सुबह उठ के सबसे पहले we use phone only, है ना. So just revise it, give 10 minutes for the revision. And I believe कि if you give 10 minutes एक बार सुबह revise कर लोगे पुरानी चीजें, so you will have that fear will go कि I'll have to revise it again. Okay, just keep 2 hours for your theory. I'll say 1 hour for the long case and 1 hour for the OSCE. That is more than enough. And आखिरी के 10 दिन 15 दिन apply for छुट्टी, है ना, so that you can push your studies 4-5 hours. I think 4-5 घंटे से ऊपर तो शायद ही कोई पढ़ता होगा, but still if you can manage more, it's up to you. But last 10 days 4-5 hours is more than sufficient.
So should we read any practical based book also like Sena and all?
एक चीज पकड़ लो, कोई भी एक चीज, help you in confidence. हाँ, any one book, ठीक है. Don't fall into that trap कि I'll do 5 books. That is wrong thing. ठीक है, whatever you have done in your whatever in the what to say residency में what you have read, one book, just read it completely. But believe me, जब भी आप will complete the book ना, you'll realize कि the same thing is given in the all the things. थोड़ा बहुत कम ज़्यादा, like someone would have given 2 points in the end, 1 or 2 in the initial part. So one book, like suppose you are reading Vikasana, that's fair enough. Okay, so that your all questions could be clubbed at one single place, and every time update your notes. Don't make new notes. ठीक है, whatever you have read, the extra point which you get, write it there only, so that whenever you revise, it will give you a revision वाला feeling आएगा, rather than कि मैं सब कुछ नया कर रहा हूँ बोल के.
And sir, you asked about the sequences. Which sequences of MRI do we have to read? All the sequences.
हाँ, उसमें nothing. You have to read the full form.
From where? So from where? Just the full form, okay, sir.
Only the full form. See, you are not radiologist. ठीक है, you are not radiologist. See, I am down 5 years down my PG, and what I have seen is, remember reading HRCT temporal bone. This is, I'm not saying for the exam, for the ये क्या बोलते हैं, for the ENT perspective. Just be confident you will become confident when you see cases ना, you'll become confident. HRCT temporal bone आना चाहिए, NCCT PNS आना चाहिए. This is the basics. उसके बाद फिर इट्स लाइक कि मतलब डिपेंडिंग अपॉन योर इंटरेस्ट कि व्हाट यू लाइक यू कैन गो एंड डू फर्दर, ठीक है. MR एंड ऑल लाइक एवरीथिंग इज डिफरेंट, मतलब देयर इज lots and lots to fathom over there. Okay, so remember the end sequencing. ये वाले जो है आपके जितने फ्लेयर है, फिएस्टा हो गया, ग्रापा हो गया, सिस हो गया, I'll share the sequence, keep on sharing the sequences. Okay, and generally this is not asked कि identify what is the sequence, ऐसा कुछ नहीं आता है क्वेश्चन में, ठीक है. They'll just ask you full form, that's it. And where is this important, like cis is generally seen in the CSF rhinorrhea diagnosis where you use it. Okay, so there is one few specific thing is associated, read about it, not ki how to do it or how to, this is the work of the radiologist, let him do it. Okay,
sir, thank you.
Okay, anything else, doctor? Nothing. So let's call it a day. Keep on revising, be healthy, don't fall sick and all. That is the most I'll say ill thing which can happen to us. So be healthy, keep on reading little bit, and let's meet again on 24th. Till then, evening 9 o'clock, we'll see few important questions on WhatsApp and read about serum. That's important. Chalo, bye, good night.
Thank you,
Take care.
sir. Okay.